I'd like to introduce Dr. Cristina Louk. She owns Peace Humanistic Therapy, and I'm pleased to have her here to talk about a topic that's really important for me, but selfishly, but also for a lot of my friends around ADHD and menopause. So, Cristina, why don't you talk a little bit about your background, and then we can get into some of the things that I think will be really beneficial for our audience.
Yeah, thank you so much. I'm so glad to be here and be with you guys. So my background, I have a PhD in clinical psychology, and my education was in neurodevelopmental disorders, mainly because I was seeking just to help myself and then to help other ADHDers along the way. You know, being a woman with ADHD, with all the research on the boys and the men, I really wanted to put a female face out there to be an ADHD advocate. So I specialize in ADHD at my practice, Peace Humanistic, and I really specialize in how ADHD turns up in us women. My ADHD background, I was diagnosed in 1980 after being sent 2 times to a psychologist in school. I was a hyperactive kid. So I've had this for as long as I've known about it. But what breaks my heart is most women don't get diagnosed until later on in life. And hormones can also put a play on that. And I would love to address that too, why it takes us so long to get diagnosed. So yeah, that's just a little bit about me.
That's awesome. So thank you. All right. So you actually got diagnosed at a long time ago, and I'm turning 53 in like 2 weeks. So, I guess my thing is around like, how did we get here? Because when I was a kid, so there was no ADHD. And honestly, people didn't even talk about autism. They used words that don't fly today in terms of how you described kids who were slower or didn't perform well in school, or they were the bad kids and everything else. And, so like when I was in school in like the 70s and 80s, this wasn't a thing, at least where I lived in suburban New York City. So how did we get to all of a sudden ADHD? Because I feel like there's been a lot of steps along the way.
Yeah. When I was diagnosed, girls didn't have ADHD. And the only reason I was diagnosed at that time was because I was hyperactive and the teachers didn't want me in class anymore because I was all over the place. And I was I had so much energy. They thought that I was intellectually disabled and wanted to put me in special class. And so they made me go and get an IQ test and an ADHD test. And it came back with the recommendation that I skip a grade and that they stop, harassing me. Now, unfortunately, my school did nothing. They labeled me as a slow learner and I was put in the lowest classes. So there was no, so the quiet girl in the back, if I was getting diagnosed being the loudest kid, but nothing was happening to me, the quiet girl in the back was just getting ignored. So through the 80s and 90s, started to come a little more research noticing that, females were also having ADHD, but it's still slow. To be really honest, most of the research is still on the guys. So we're still trying to get there to kind of have more recognition on our struggles as well. But it's been a slow go. I mean, we started with ADD, and then now it's ADHD because we're recognizing that even though we might not be hyperactive, every single ADHDer is hyperactive in our mind. Our minds never shut up, right? And we're restless. So that's how the H got tagged on to ADHD. And now it's really broadened into neurodiversity. And we're seeing that most of us ADHDers have a lot of symptoms consistent with, autism. We're not autistic, but we have a lot of symptoms similar. And we're able to also see autism come up with us in the research and what's being, known about it. So it's been a slow roll for us girls, but we're getting there.
So what I'm curious about, are there still ADD diagnoses happening, or has that been totally eclipsed by ADHD?
So it's all in the Diagnostic statistical manual. That is the manual we use to diagnose. They retired the term ADD. And so now it's just ADHD. It's really just in the language that is used for diagnostic purposes.
And do kids get diagnosed with autism? Because that seemed to be very prevalent, I would say, honestly, in the past like 20, 25 years. Like I had friends who have kids who are diagnosed with autism. Is that still happening?
Yeah, it is. And the great news about this is our autistic friends that are the old term Asperger's, that real mild autism, we're finally getting diagnosis for those folks. So that is really, really important because they, as adults, they're, sitting there going, something is going on with me and I don't know what it is. I also do autism assessments for adults, and it's game changer when they realize, oh, this is why I do what I do. There's nothing quote unquote wrong with me, right? Because they go through, I remember being told, what's wrong with you? Why can't you just be still? There's nothing wrong with me. I'm just different than neurotypicals. Maybe there's something wrong with them because they're not like us, So same with our autistic friends, they're finally getting the diagnosis too.
Appreciate the background because I think that's really important to kind of set the stage. What is the prevalence of undiagnosed ADHD in, say, the adult population, we'll say US and Canada, because I know we have some Canadian representation on the call. And then how much of that is women?
We don't really know the true prevalence of undiagnosed. And mainly because now just getting people coming in wanting diagnosis. I think that what we can look at is just, and I don't have the figures, but I can tell you that the diagnosis has jumped significantly over the last 10 years, mainly because people are going out and getting the diagnosis as adults. So we're seeing this huge rise in ADHD. You'll hear people out there saying, oh, well, why is there more ADHD? It's a fake disease. There's more now than there was before. Well, yeah, there's more now than there was before because we have more access to diagnostics, and more people are getting diagnosed. So yeah, the numbers are increasing mainly because we're all getting diagnosed. And a statistic that I find really fascinating with girls is that as elementary little kids before puberty, the ratio between boys and girls is 3-1. However, when puberty hits, the ratio goes to 2-1. And once we get to adulthood, it is 1.5-1, all because of hormones. When those hormones hit, our symptoms worsen. And that's when most kids, puberty age, say, hey, something's going on, and they go get diagnosed. So there's a lot of different things kind of at play here. But you're going to be seeing more and more ADHD. You're going to see the diagnosis go up, not because ADHD is more prevalent. It's just more of us are getting diagnosed.
Yeah, it's not like an epidemic, so to speak. It's more of,
it's not an epidemic.
It's just more of people are becoming more aware of symptoms.
Yes. And people say you shouldn't be diagnosed off TikTok, but social media has really played a role in this because sharing symptoms, and people are sitting at home going, oh, those are my symptoms. And it makes them then go to the doctor and ask some questions. So we're getting people diagnosed and getting answers that they need.
That leads into, I guess, next topic is, let's say I'm on TikTok. I mean, I'm not on TikTok, but I'm on social media and I'm seeing this, or I'm hearing a friend talk about this. And who do I go to? I don't know. Do I go to a neurologist? Do I go to my GP? Like, do I go to a psychiatrist? Like, how do I know who to go to figure out what's up?
Yeah. There's so many places that you could go. You can always go right to your primary care and start there, just to kind of get the conversation started. Another thing you want to do is talk to your insurance, because some insurances require you go to a psychiatrist if you want insurance to pay. Or you can also go on Psychology Today and just kind of type in ADHD assessment and you will find a clinician. There's so many of us out there. It's a lot of us out there, and you will find somebody to do your assessment. But one thing I recommend is make sure if you do go through the assessment is find somebody you're comfortable with. Especially for females, I hate to say this, and I have so many colleagues out there that are men, but some of the symptoms can be really subtle with us. And so if you have more subtle symptoms, find, a clinician that really, focuses on, how ADHD presents in women.
What's an example of like one of those of some of those subtle symptoms that maybe people might not be aware of?
Yeah. It also, I'm also going to put a caveat on here that it might not also be the subtlety of the symptom, but how you mask. So that inattentiveness is the subtle symptom, because oftentimes as girls, we mask that. And so a lot of the symptoms that we have, for example, I was the hyperactive kid. Why can't you be quiet? Why can't you sit still? Well, then, okay, I'm going to sit still and I'm going to be quiet. Does that mean I don't have ADHD? No, I learned to mask. And so, there's that kind of component. So if you have this really, really subtle inattentiveness that you notice, other people might notice, but really don't, but then you act like you're paying attention. No, I'm present. I'm present. Those are the symptoms, and so some of us have to learn to unmask a little bit, to let those symptoms come forward, to really see the depth of them.
Yeah, I was having a conversation last week with a couple of friends, and we were talking about the fact that potentially what we could get away with when we were younger in terms of what you call masking the symptoms and how we kind of compensated without realizing we were compensating. All of a sudden it's like, wait, that doesn't work for me anymore.
Right.
So let's say I come to you and I'm like, all right, let's leave out the insurance approval and blah, blah, blah. But I come into your office and I'm like, hey, I don't know, like, I got brain fog. I'm dealing with all the menopause stuff. I'm just having trouble focusing. So what's that process like? And I'm, in general, when someone goes in and says, I need help.
Yeah. So we do want to go through the assessment kind of process to really narrow things down, because brain fog is a part of ADHD and menopause combined. Ooh, when we talk about that, there's so much there. But it also could be depression. It could also be PTSD. And so a thorough assessment really looks at all the different areas. So then it can really come down to, we can really find that it is ADHD. And the assessment looks at a lot of things. So we look at the symptomology that you're having. We also look at your executive functioning. That's that frontal lobe, planning, working memory, those different traits. And so we really kind of break that down. And then when we really hone into ADHD, then we can then go through the diagnosis. But oftentimes ADHD is comorbid with other stuff. Living with ADHD, a lot of us get anxiety because of our symptoms. A lot of us also experience depression because of our symptoms. A lot of us also experience trauma from how we were treated because of our symptoms. So oftentimes it's with another disorder. However, we look at all of it. So at the end of the day, you leave with a report knowing exactly what's going on with you.
Well, I think that a lot of times, especially when you're going through menopause, you're being gaslit about your symptoms. And so there's kind of figuring out like what's actually happening here. And, it's like, oh, it'll pass, that type of thing. So there's a question that came in and person wrote, thank you, Reba. I'm curious about the tie-in for ADHD and postmenopausal women and how that ties into hormones. And I know, we're going to be talking about different things around the female menstrual cycle, whether you're perimenopausal or postmenopausal. So I guess let's talk about the postmenopausal aspect of it and impact on hormones. And Reba, feel free in terms of jumping in terms of if you need clarification on anything on the follow-up.
Yeah. So a little history and a little self disclosure on my part. I am in menopause, and it was a couple years into my perimenopause. My perimenopause was 4 years long. It was a nightmare. About 2 years in, I started getting significant brain fog. I would have these huge memory gaps, and I wouldn't remember like the town next to us, and it would just be gone. And I went to my husband and I said, I think I have early onset Alzheimer's, but then it would go away. And then like a couple weeks later, it would happen again. And so I was, in my doctoral program at the time. And so I did some research and realized that, So ADHD, this is a connection with my ADHD. And now that I'm in menopause, I still experience the same thing. These momentary gaps in my memory, or this really intense brain fog, this lethargy. And what's happening is with ADHD, our symptoms are really connected with some neurotransmitters in our brain, specifically dopamine. And that dopamine really gets sucked dry when our hormones are fluctuating. And so what's happening is I'm having this huge deficit of dopamine at different times of the month, which is connected to, the hormones going up and down, and then the slow deterioration and the worsening of the ADHD symptoms. So love the research, because there's none. There is less than 5 studies out there on this. I mean, there's just nothing really out there. And the research is now just in theory of talking to other women and what they're going through. And what they found is with perimenopause and menopause, there is a significant worsening of all the ADHD symptoms. We have greater inattention. Our working memory tanks. And this is the worst part. We have difficulties with emotion regulation. So if you feel like you're all over the place with your emotions, this is ADHD and hormones. Now, hopefully they will do more research on this so we can at least have some answers. We have no answers. We just know that this is happening. But the more and more women I talk about in perimenopause and menopause, I started to realize I am not the only one. There's others out there that are really, really struggling. The ADHD medicines do help, but you're still going to have some struggles as your hormones fluctuate through the month.
Let's say you get a diagnosis. What are the benefits of dealing with it? When you're thinking oh, there's something wrong with me, it's okay, how do you get someone to the other side, in essence, to sell them, for lack of a better term, that getting the diagnosis is actually a good thing?
Huge. Well, it's a game changer. Knowledge is power. The diagnosis it's more than just getting the diagnosis. The diagnosis is, if you go through somebody like me, it's a 10 to 15 page paper that lists every area where you're struggling in and every area where you have a strength in. If you look at all of the different executive functioning components, you might have 4 that you're really struggling in, but 2 you're really great at. Well, if you take that to a therapist who specializes in ADHD, they're going to individualize a treatment plan that's really going to hone in to really focus on the areas you're struggling, but also to show you how to lean into the areas you're good at. Because at the end of the day, ADHD is a gift. We have strengths they don't have. So if you can manage your symptoms and lean into the stuff you're good at, you're going to be in a much better place. We have divergent thinking. We are creative. We are resilient. All these things we can't lean into because we're worried. We're dealing with self-management to time, or we're struggling with planning and organizing, or our working memory is, shot, and we're beating ourselves up over it instead of just using a tool, an app to help, track stuff. So it'll give you, not, as I said, knowledge is power. It'll give you power in your own treatment, and then you can really guide your own treatment.
Oh, all right. So, question came in. Is there a risk of losing your superpowers if you take the medication?
No. So let's be really honest about the medication. The medication is not a super drug. It helps with motivation and it helps with attention. That is it. It is not going to help you with your working memory. It is not going to make you a better planner, not going to make you a better organizer. It's not going to help with your self-management to time, but it will help you stay focused and motivate you to do the work to fix those areas. One thing that I do when we're speaking of medication is that emotion regulation piece. I don't know if any of you experience rejection sensitive dysphoria, the RSD, or big highs and lows with emotion regulation. There is medication out there that does help with those. It is guanfacine and clonidine. Those medications help that set of traits. So, a lot of us kind of do both, and that really, really helps. But not only medication, you got to do behavioral interventions to do the full, to really help yourself with your ADHD.
So how does that work? So I get diagnosed and I get some medications to help me with my focus, so to speak. So then what's what I'll call the therapy work that's involved?
Yeah. So in my practice, I offer like this 12 session, like down and dirty. Let's go through all of the executive functions and give you tools to manage those. I also work with people in therapy, just kind of as we go through our, weeks. This is what I'm struggling with. Well, let's plug this in. Let's see if that works. So you're going to learn a whole bunch of tools to kind of put in place. And for example, one tool that it's the first tool I tell all my ADHDers is we have some issues with our frontal lobe, with that planning, the organizing, staying on track. And so I tell all of my people to keep a to-do list. Why do we keep a handwritten or a computerized to-do list? Well, neurotypicals can keep 10 things in their mind and chunk them down. We struggle with that. We're going to have 10 things in our mind and we're going to do 3 of them and forget 4 and 5. And then in 2 weeks, remember 8, and so write them down and then cross them off as you go. Simple tools like that will help you feel more in control and more able to deal with certain aspects. But tools like that, really tangible things that you just plug in, then you won't see so much deficit in how you're interacting and dealing with your life.
Then on top of that, we talked about like accommodations for work for people on this call, because I know that someone in my family, they have a child who has ADHD, and so there's certain accommodations for school, but then there's like, oh, I got to ask for an accommodation at work and I don't know how that's going to fly type of thing. So what's been your experience with that?
Accommodations are tough. I love human resource people, but let's be really honest. I have seen it to where it will bite you in the butt. So you need to kind of ask around before you ask for accommodations. Like what is the temperature here at this office? Are they, do they accept this? Are they accommodating? But stuff that I've asked for myself, we're having a meeting. Can I get the slides ahead of time? Can I record the meeting? These are accommodations we can ask for, because if I can get the slides ahead of time and I can record the meeting, then if I blip out on a distraction, I can go back and listen to it. And then I'm on it. Because the reality is we're going to get distracted and we're going to miss something. So it really depends on the temperature at your office. And then, if you're willing to divulge. A lot of people are, and a lot of people aren't. I divulge in the interview because I beg them to tell me where ADHD is a weakness. I will sell ADHD as the biggest strength, and they'll want to hire a whole bunch of ADHDers, when I'm all done with it.
So ADHD, does it fall under ADA?
It does. Yeah. Yes, it does. Uh-huh.
Okay.
We are a protected class.
Protected. Yeah, but we all know, to your point, that anyone could work around anything if there's a will and a way to do that. Right. So I think it's important to just be candid about how you frame it if you are going to disclose it. And obviously it's a personal decision for everybody in terms of what they do. So now let's go back a little bit, because because of the people on the call, we went to postmenopausal, but I'm curious about the perimenopausal and even people in their 30s going into perimenopause. What should they be on the lookout? Because honestly, I definitely have some focus problems. I'm not self-diagnosing myself. I'm not a therapist. I don't play one on TV, but I definitely have some focus problems. And in thinking back to some of the tactics that I've used, it aligns a lot to what you said. So the thing is that I don't want my friends who are younger to not be educated about what to look for. So can you talk a little bit about that?
Yeah. So let's talk about just the kind of the life cycle of a woman, and when we go through puberty and we hit our menstrual cycle. So after you had your period, the month starts, your estrogen, kind of starts to decline. They're noticing that this is leading to increased hyperactivity, increased impulsivity. This is the worst part, increased risk-taking behaviors. And all of those executive functions, all kind of start to dwindle. And so we're seeing, that's the time, right before you ovulate, where you're going to make some really rash decisions. You might be a little more fidgety, a little more agitated, a little more restless. Then the progesterone changes. then all of that goes away. Now you have increases of inattention, more irritability, and you might even see some depressive symptoms come. And that just cycles you right back. And then you're going to go right back into hyperactivity, risk taking. And so at different times of the month, your symptoms, certain symptoms are going to be worse than the other symptoms. And then they flip flop. And so I have women now really like looking at their cycle and then looking at their emotions as they go through the cycle. So we can really individualize how their cycle is impacting their ADHD. We are seeing it, and we know there is a correlation between the two, and we know what the correlation is. We just need more research on this.
What's interesting is that, there's always like, oh, someone's PMSing, right?
Yeah.
Like the good old, like, oh, she must be PMSing because she's moody type of thing. And I actually, from like strength training, I knew that when I was getting my cycle regularly, that the week and a half leading up to when I would get my period, like I was probably not going to have a great workout. And then once I got it, then it's like, yeah, let's go throw around some weights and crush it. So what you're also saying is that the estrogen is also impacting just overall mental health, and not just like your physical capabilities, but your mental capabilities as well.
Yep. And your emotionality.
Right.
Yes. Yeah. And then when we go into pregnancy, that's a whole other thing. They actually call it ADHD brain when an ADHDer is in pregnancy, because they actually see huge deficits in working memory, huge concentration and attention, and even bigger changes in emotion and mood. And a small little sect of my practice, I work with women that are pregnant, that are going off meds. And so I work with them throughout, pregnancy, lactation, that whole thing, because they're not on meds, just to give them behavioral strategies that they can put in place. I also work with a ton of people that are unmedicated. I was not medicated until an adult. I was diagnosed at 9 years old, but I didn't get my first medication until I was like 26, 27. So I learned all the behavioral stuff. So people out there, I also want to put out there, you don't have to be medicated to treat your ADHD. You just have to be willing to put in the behavioral tools and tricks, and to do that. So just wanted to put that out there too.
No, I mean, it's great because there's some people that may be concerned about medication interactions.
Yeah.
So for example, my husband's on anti-seizure medication. So if there's a priority between what he has, if he was diagnosed and there's a priority and there's not a good interaction,
right,
you have to know that and be able to make that call in terms of what are you optimizing for, so to speak.
Exactly. Also, another little thing is it's not all about stimulant medication. There is a non-stimulant medication out there. In fact, I don't take stimulant medication because it doesn't work with me. I take a non-stimulant and it is just as effective. It's great. So if you have an aversion to the stimulant medication, don't let that dissuade you from seeking medication. There is a non-stimulant route.
So this question came in. So I'm just going to read it. I've read that the cerebellum has a lot to do with ADHD challenges. It also controls functions such as balance. What are your thoughts on balancing exercises helping to boost the strength of your cerebellum to help with your ADHD symptoms?
There's no research on that. And I don't know if there's a correlation with ADHD and balance. I'm an ex-ballet dancer and I have impeccable balance. And I had a lot of friends that do gymnastics and that. So I don't see it in my world like that. That's a correlation. I haven't seen it in the research, but I'm not saying that it's not there. The whole cerebellum area, that the motor cortex is right up in there. So there very well could be, because the motor cortex is so close to our frontal lobe that I could see there's a huge connection in there. Balancing exercises are great. Here's where it would really be great for an ADHDer. It would help train your focus. It will also help ground you, because when you are balancing, you have to turn your attention inside your body. One of the things us ADHDers struggle with is that connection with feeling kind of are outside of our body. So that really would help. So I would be a strong proponent for balancing to help your ADHD. I think that would be great.
Awesome. So I guess then what I would want to, I'm trying to think, wait, there were a couple of people who read a book. Let me scroll where it is. A second. This book by, ADHD 2.0 by Edward Hallowell and John Rady, and then Healing ADD, which has been revised by Daniel Amen. I don't know if you're familiar with these texts.
The ADHD 2.0, yes, I have. I've actually read that. It was really, really good. Dr. Amen, I love Dr. Amen. He's fabulous. The only kind of caveat with Dr. Amen is he does brain scans, which are great, but they're not a diagnostic tool. They're not recognized as a diagnostic tool. There's no way to see it. His is more of a research to kind of compare. So he has seen some similarities, but we don't recognize brain scans for diagnostic purposes. Although his study and his research is fascinating. And I used to be a Dr. Amen geek. I read all this stuff and I watch all this stuff. He's really knowledgeable. He knows what he's talking about. And I would love for us to be able to prove the brain scan. What a great assessment. You'd be able to go in, scan your brain and get the diagnosis. It would be like a life changer. We're just not anywhere near that yet.
So actually, you brought up a really good point around stimulant medication versus non-stimulant medication. Mm-hmm. So one of the things that I work with my clients is how to be better advocates for themselves when they go see a medical provider, because in a lot of cases, you're going in and you're seeing your primary care physician and you got like 10 minutes.
Yeah.
And so you really have to make the most of that time. So what questions would you advise someone, right, to go and have prepared when they're going to go talk to their primary care physician or a psychiatrist or whatever it is, so that they can advocate for themselves? Because I see this all the time, even with my own experience in the healthcare system, and I'm a fairly educated person on this stuff and do my research.
Yeah. One of the things that if you have ADHD and you want to get medication and you do not want stimulant medication, you have to really advocate for yourself. And this is why. Stimulant medication has been deemed the gold standard treatment for ADHD. They, as in like the establishment, believes that all you need is a stimulant medication. Most insurances will make you go on the stimulant medication first. And if that doesn't work, then we'll pay for the non-stimulant. You need to go in and you need to be very forthright with the physician and say, no, I don't want to try it. I want the non-stimulant medication. You have to be the one that kind of demands it from your insurance company. You need to call your insurance companies and say, no, I don't want to take the stimulant medication. They will generally agree and will let you do the non-stimulant, but you have to know going in. They will push the stimulant. And if you don't want it, just be prepared. But they will push it.
Women in, going through perimenopause have enough trouble sleeping. So I'm guessing stimulant medication would not help solve that problem.
And it makes you run hotter. Like, I don't know how you are, but I'm having hot flashes like nightmare. If I was on stimulant medication, I would be having like huge spikes and being so hot all the time.
Right. Yeah. So what else other than like this? I mean, I think that's a great point, to educate people on why you want to maybe defer to non-stimulant medication, or at least have a conversation with your doctor saying like, tell me is the medication that you're prescribing to me, is it a stimulant or is it non-stimulant? Right. And explain why they would prescribe a stimulant as a default, and forcing them to have that discussion with you. Are there any other topics that you would say force the discussion and make them explain it to you or ask the question so you're not flying blind?
Yeah. Just to clarify, are we talking about for medication?
Yeah, well, it could be for anything. It could be for medication, but it could also be just like, I don't know what I don't know. Right. So the thing is that I think a lot of people, they don't know what they don't know when they're going into something. And it's helping people be like, look, you should ask, at a minimum, ask these 3 questions so that this way, you're working with someone. You talked a little bit earlier about, okay, this is what you want to look for in someone, potentially, but also what are the other things that Like if I came to you and I'm like, oh yeah, I was seeing someone and I was really frustrated, and then you're like, oh yeah, I wish you would have asked this question, right? So
Yeah.
does that question make sense?
Yeah, it does. It does. So what I always tell my clients before they go even ask for medication and go in, we want to look at the symptoms that you're trying to fix. And so some of the symptoms, might lean toward the stimulant medication and some might lean toward having the non-stimulant medication. So when I would go in there, I would ask them, the doctor, these are my symptoms. Is this medication going to focus on these symptoms? I'll give you an example for the stimulants. For my clients that have significant lethargy and brain fog, and they're having a really hard time, like just standing up, and they are out there. I mean, there's an ADHD class that lethargy, inattention, that is the strongest. Where I'm hyperactive, it's like the opposite. So they're going to want to go the stimulant route, but there's just more than one stimulant. There's Adderall, there's Ritalin, there's Vyvanse, there's Concerta. And so I would want to know from the doctor, out of those stimulants, one, is this stimulant going to fix this issue? And two, how is this going to impact me and my menopause or perimenopause symptoms? Three, is this going to have any impact on hormone replacement therapy if that's what I choose to do? And how is this going to interact with all my other meds? So here's magnesium and stimulant medication don't work. Magnesium kind of like cancels it out. So that's what I also want to know. Are any of the supplements I'm using going to impact any of these medications?
Yeah, well, magnesium is a very common supplement for menopause.
Yeah.
And I mean, there's different types of magnesium, obviously, as well. So I'm surprised we haven't covered this yet, and I didn't think to ask this. What causes ADHD? Is it genetic? Is it environmental? Like, what do we know about what causes ADHD?
Yeah, it's a both and. So for the most part, it is a genetic disorder. It is found in families, very hereditary. So if you have it, there's like a 50% chance one of your parents has it, and a good chance that a sibling has it. So it does run in families, but you can also get it from environmental places. Lead poisoning, old houses that have lead paint. If you were a child and you grew up in a lead house, and had a lot of that around, that could also cause ADHD. So there's environmental things that could cause, some changes in your brain. Some gestational things when you were in your mom's belly could have kind of made some changes in how you developed. It's a developmental disorder. So it's something that happened to your brain during the developmental period that has caused this. So it could be genetic and environmental. Here's a little freak out a little bit. You could actually get it as an adult by having a traumatic brain injury. If you have a TBI in that frontal lobe, you could actually get an ADHD diagnosis, because that's the same area of our brain that is having the same kind of issues.
Yeah, someone in the chat commented that that's how they were diagnosed via some PTSD and TBI.
Yeah.
So it sounds like there's whatever impacts.
There's a lot of ways.
Your brain. Mm-hmm. I mean, because obviously you go through a traumatic experience, that's gonna, change you in such a dramatic way that, you're going to be completely rewired because of the trauma around that.
For sure.
So one of the listeners is, hey, I have more energy than most people. I would put myself in that category. So what would be, if I was assuming I was diagnosed, and also let me just add in again, this is for informational purposes only. And, if any advice here, you'd need to engage in an actual doctor-patient relationship with Dr. Louk. So I just want to make sure we say that loud and clear. But if I'm a person who has a lot of energy. So we talked about and I definitely do not want to be on a stimulant. I don't even drink coffee, which surprises the hell out of people with the amount of energy I have. But the thing is that what would be the recommendation on how to do some research on medication so I could go in and be educated and saying here are the medications that I've read about and that I have an understanding of. Yes, I'm not a doctor, but in terms of the side effects, these seem like they're not going to mess with me too much.
Yeah. So we're looking for a research source.
Yeah.
I actually have the person to go to. If you ever have a question, this is where you need to go.
Oh.
This person is all of us look to him. He is the main researcher, the guy. His name is Russell Barkley, Barkley. He has a YouTube channel that every week he puts the new research out. You can watch it. If you go to his YouTube channel and just type in like medications, watch the video. Really what he says is that is it. That is what we know. And he is the source. He has tons of books out there. And so if you see him as the author, Russell Barkley, pick it up because he knows. He also has a video on menopause, and he talks about the journal article Attention Deficit Hyperactivity Disorder on the Menstrual Cycle Theory and Evidence by Eng and colleagues. That's like that's like the research paper that's out, but he actually talks about it and talks about what we know. So yeah. If you ever need an answer, that's the person to go to.
Okay. I just put the website. He used to be, I guess, the president of the American Psychological Association. Is that the dude?
Yeah.
Okay.
Yeah, he's the guy. But his YouTube channel is amazing. I watch it every week, so I'm up to date on all the research. And he's just a funny little guy. He doesn't have ADHD. I want to also, okay, so he does not have ADHD. He is not neuroaffirming. So know that going in. He has a doctor that treats people with ADHD. Unlike me, who has ADHD, and I'm totally neuroaffirming, and I'll tell you, you have superpowers and strengths. He uses deficit language, which I don't really like, but he's great. He knows his stuff.
All right. So, in terms of, so maybe we can just go in a little bit more specifics on the non-stimulant type of medication.
Yeah.
What are the known like side effects that people should be aware of when taking these medications?
You're going to want to watch. It's all the same side effects that you're getting from all the other medications, right? You're going to want to watch if it's going to make your heart beat faster. If the non-stimulants, is it causing, you to feel weird? The thing with the non-stimulants is there's, from what I've seen, less kind of side effects than like the stimulants. The one thing about so here's a piece that is really important. People that go on stimulant medication, they take the medication and they feel it instantly, like it's on. And then after 6 hours, that medication goes out of their system, it's out and they crash. Like it's so sudden. Non-stimulant medication takes 2 weeks. It is subtle. So if you take it and you don't feel like you feel the same, give it time. It takes about 2 weeks to kind of come in and a couple of weeks to get out of your system. What's great about that is if you miss a dose, you're not like the ADHDer over there who takes the stimulant and forgot his medication that day. And then they're crashing. So it's a little more subtle and more gentle on the system than the up and down that stimulants can give you.
Is there a risk if you have like a heart history, genetic heart history with these ADHD medications, stimulant and non-stimulant?
I would make sure that I got an okay from my cardiologist before I took either.
Okay.
If you have a history of heart problems, for sure.
They
will probably, they probably will not prescribe you a stimulant, but they would probably a non-stimulant.
Have you seen anything with the non-stimulant in terms of?
I have seen people that have had cardiology kind of issues, and they're on a non-stimulant.
Okay. Got it.
Yeah.
Another question that came in is that, are you planning on doing a study of your own due to the lack of studies on women?
I know, it's in the back of my mind. Yeah. We need something. We need research. So, my background is research. So it's always an option.
What is the go-to for, like, let's say someone's being dismissive or mocking of ADHD as like, oh, everyone's going to have ADHD.
Yeah. Oh, you wish. That's my comeback. You wish. So I'm in Seattle, and several years ago, there was a trend in Seattle where everyone wanted to have ADHD. And so I saw a ton of people come through getting assessments, and they would cry when I would tell them, oh, you don't have ADHD. So there is a part of this culture that people want. They want to be a part of our culture, and that's great. I love that, and I want them to enjoy and live in our strengths. But at the end of the day, no, not everybody has ADHD.
Well, I think that there may be people, like, for example, I don't know if I have ADHD, but I know that there are certain things, but perhaps the behavioral therapies could be beneficial to help me keep my focus and stay focused. And I think that there's that aspect of understanding that the treatment is, dual pronged. There's the in-person, whatever, connection therapy, whether it's in person or virtual. And then there's the medication or behavioral parts of it as well. And so I guess it's three-pronged. There's the behavioral aspect of it, because even if you're on the medication, I'm guessing you still have to make behavioral changes.
You do.
Right. And then
but the behavioral changes, everybody, we all need to make. There's so many of us out there that struggle, that don't have ADHD, that struggle with attention, that struggle with motivation. I have a lot of folks that have depression or trauma, and they have all the same symptoms. Well, all those same behavioral stuff is going to work for all of us. It's just, how do we plug those in?
Yeah, for sure. So is there any other topic that you would want to educate people on that I haven't asked you, going back to the I don't know what I don't know thing?
Yeah. My biggest thing is, if you think you might have it, find out. There's more that you can do for yourself if you know, and if you don't know. And then if you don't have it, what's going on? Like, why do I have these symptoms? Is it nutrition? Do I have another mental health issue? What's going on with me? With women, we tend to, suck it up. We tend to be the strong ones. That's why a lot of us didn't get diagnosed when we were kids. We were the quiet ones in back. We didn't want anybody to pay attention to us because, we're the nurturers. We cared about everyone else. Well, at the end of the day, we have to take care of ourselves in order to take care of everyone else. So, we need to just rise up and find out about ourselves, and then get the help we finally deserve, especially around like this menopause, especially around any of the hormone piece. Because for a lot of us with ADHD, it's been really, really hard. And we need to start talking about it amongst ourselves. So our other, fellow women going through menopause, no, it's not early onset Alzheimer's. You just have ADHD and you're going through menopause.
Yeah. I've specifically thought that I've had like early stage Alzheimer's or dementia. And I'm not even like saying it tongue in cheek. So then I guess the question is that what are symptoms of, say, early stage dementia versus like, how can you like reassure someone, even though they're, you're not making a medical assessment, but just in general, there's probably very different symptoms that seem similar to brain fog versus dementia.
Yeah. I don't specialize in dementia or Alzheimer's, but I can say that with ADHD, you will see it fluctuates like within the same day. One out, like at lunchtime, I might feel really foggy and lethargic, but I'm hitting a 1 o'clock meeting and I'm fine. I get some caffeine and all of a sudden I clear up, right? I self-medicate a little bit and then I'm a little more focused. So you'll notice that if it's more transient during the day, and it's not every day. Where somebody who's going through dementia and Alzheimer's, it's, you're seeing stuff on a continual basis, right? Where for me, it happened that one day and the next day I was fine. And then I didn't see it for a couple of weeks. And then I saw it for an hour here. And so it's very spotty with ADHD.
Are there certain times of day where you're more focused? Like, is the morning better for people with ADHD versus being like, if you're a morning person versus a night owl, have you seen that?
That's a great question. We're all different. And I teach this in my 12 sessions, and I also teach this to all my clients. We are all so different, but we have these couple hours of the day where it's for me. So for me, I wake up in the morning, I have so much dopamine in my brain that I am like on fire. And so I'm great at the morning, and I'm also great around like 3 to 5 p.m. I have clients that are night owls that their dopamine hits, later on. The main thing is there's different parts of the day where you have more dopamine in your brain. And that's when you're going to be the sharpest. So start paying attention to that. And it stays pretty much the same. So pay attention to when you start feeling, the best. Another piece of it is dopamine is free. You don't need medication to get it. Simply standing up from a seated position gives you a pop of dopamine. Exercise, pop of dopamine. Doing something I enjoy, pop of dopamine. So what I would recommend is if you're feeling sluggish, lethargic, inattentive, you just, I can't get going. You can Google free ways to get dopamine and come up with a list. On my website, I think it's in my blog, I have a list.
Okay.
So what I have like stuff I do that I just, okay, I'm feeling a little like inattentive. So I will do, I do big, I'll do yoga stretches, which when I'm done, I feel like I'm a little more focused. I'll run up and down the stairs in my house, helps me. Even I'll eat a piece of chocolate, that pop of dopamine. So the goal is to get dopamine in your brain. Dopamine equals attention and motivation.
Okay. Well, I've certainly learned a lot in this past 50 minutes. And so I'm very appreciative for your time.
Yeah, I'm going to put my website in here.
Yeah.
I have a blog. I have a blog on the website. I also have a resource page, which has a ton of information, different articles, different videos that you can watch. So that might be a kind of a starting place for you to just kind of get you answer some questions or kind of get you moving in the right place to get those questions answered.
First of all, thank you to Cristina for joining. And I'll remind everyone that this is not medical advice. Please go and find out from your medical provider to get a diagnosis. Go Long is here to help women over 40 become more empowered in terms of so that they can live their life and go the distance. And that means getting educated about your health, whether it's mental, emotional, or physical.
Bye, you guys. Thank you.